Hi, I'm Gege Gui, the lead statistician on the pre-measure study from the Oregon lab at the NIH. The focus of our work is precision oncology, particularly developing evidence to support the use of measurable residual disease testing for patients with acute myeloid leukemia. Pre-measure is a large nationwide retrospective study we led in collaboration with the Center for International Blood and Marrow Transplant Research to identify prognostic MRD markers by DNA sequencing of blood collected at first remission prior to allogeneic transplant. We published the first part of this study as a paper in JAMA last year. That work focused on the two most commonly mutated genes for AML patients, NPM1 and FLT3-ITD, and showed definitely that they're both good MRD targets for determining post-transplant relapse risk. The next parts of this study, presented at the ASH 2023 meeting in San Diego, focused on some of the other most commonly mutated genes in AML, IDH1 and IDH2. Our results showed that 36% out of the total 148 patients with IDH1 mutated AML had persistent IDH1 mutation detectable in CR1 blood pre-transplant. However, patients with or without persistent IDH1 mutation did not have statistically significant difference in relapse and overall survival. Persistence of NPM1 and/or FLT3-ITD mutations, however, remained prognostic in the subset of this cohort of patients. In terms of patients with IDH2 mutated AML, there were 257 in total, and 51% of them had detectable IDH2 mutation in CR1 blood pre-transplant. And this persistence is associated with worse overall survival and increased relapse. In the 41% of patients with IDH2 mutated AML who also had NPM1 and/or FLT3-ITD mutations reported at baseline, monitoring for persistence of NPM1 and FLT3-ITD rather than IDH2 mutations in CR1, however, was still the superior pre-transplant MRD testing approach. These are the largest studies addressing this specific question. The entire pre-measure initiative has generated significant evidence at a national scale about the potential of MRD testing for adults with AML in remission prior to transplant, and has shown that not all persistent mutations have the same prognostic implications. This evidence is, however, retrospective and limited to a single time point, a single sample type, and a narrow range of potential MRD targets. For our next step, we have launched the prospective nationwide measure clinical protocol, again in collaboration with CIBMTR and the National Marrow Donor Program, with funding from the Office of Naval Research, together with a network of some of the best transplant sites in the United States. Through this collaboration, we'll not only validate prospectively the findings from the pre-measure study, but also generate evidence on the optimal targets, sample sources, testing intervals, and methods for AML MRD to truly optimize prognostication for patients.